This is a NCLEX practice test for health promotion and maintenance. This practice test consists of 40 questions that cover various topics related to health promotion and maintenance. Taking this practice test will help you become familiar with the types of questions you will see on the actual NCLEX exam. Let's get started. 1. Which of the following is an example of a positive effect of exercise on a client? A. Decreased basal metabolic rate. B. Decreased venous return. C. Decreased work of breathing. D. Decreased gastric motility. Correct answer: C. Decreased work of breathing. There are many positive benefits that clients can derive from exercise, including increased metabolic rate, increased gastric motility, and increased venous return. Exercise decreases a client's work of breathing, such that regular activities require less effort. 2. You have been assigned to take an apical pulse for one of the patients in the nursing unit. How will you do this? A. You will place the stethoscope over the heart and listen for any irregular beats. B. You will place the stethoscope over the heart and count the beats per minute. C. You will place your fingertip over the patient's wrist and feel for any irregular beats. D. You will place your fingertip over the patient's wrist and count the beats per minute. Correct answer: B. You will place the stethoscope over the heart and count the beats per minute. An apical pulse is taken by placing a stethoscope over the heart and counting the number of beats per minute. Although you will also listen for an irregular pulse, an apical pulse is the number of beats per minute. 3. When a nurse does a pulse, he should note which of the following: A. Rate. B. Rate and quality. C. Rate, quality, and fullness. D. Rate, quality, fullness, and regularity. Correct answer: C. Rate, quality, and fullness. When you do pulses, you should note all the characteristics of the pulse. These characteristics are rate, number of beats per minute; quality, is it regular or irregular; and fullness, is it thread and weak or is it full and bounding. 4. What term is used to describe the sexual response changes among middle-aged men? A. Menopause. B. Climacteric. C. Generativity. D. Maturity. Correct answer: B. Climacteric. Sexual arousal among both men and women takes longer in midlife than it did in younger years. For men, this period of time is called the climacteric, and for women, it is called menopause. 5. Mr. Roberts, a 68-year-old man, notices a gradual loss of hearing. This sensory change is called underscore. A. Presbycusis. B. Xerostomia. C. Myopia. D. Presbyopia. Correct answer: A. Presbycusis. Presbycusis is the loss of hearing ability related to the aging process. It is considered a normal physical change in the elderly age group. 6. Changes, such as retirement, grandparenting, and increased dependence on others, are examples of what kind of changes? A. Moral. B. Psychosocial. C. Self-esteem. D. Psychomotor. Correct answer: B. Psychosocial. Retirement, grandparenting, and increased dependence on others are examples of psychosocial changes. 7. The community health nurse is educating a group of middle-aged women about recommended health screenings. Which of the following statements indicates that the client has understood the recommended health screenings for a 50-year-old female? A. I should get a pap smear every year. B. I should get a mammogram every 3 years. C. I should get a colonoscopy every 10 years. D. I should get my blood glucose checked every 5 years. Correct answer: C. I should get a colonoscopy every 10 years. The recommendations suggest that a 50-year-old female should complete a fecal occult blood test every year, or flexible sigmoidoscopy every 5 years, or colonoscopy every 10 years. Also included in the recommendations is that a 50-year-old female should get a mammogram every 2 years and a pap smear every 5 years. Blood glucose should be checked at least every 3 years starting at age 45 if no other risk factors are present. 8. A physician's order instructs a nurse to take a temperature at the axilla. Where would the nurse place the thermometer? A. In the rectum. B. In the mouth. C. On the temples. D. In the armpit. Correct answer, D. In the armpit. The axilla is the area of the armpit located under the arms, proximal to the trunk. 9. The pulse point located on the top of the foot is A. The dorsalis pedis. B. Is checked in patients with peripheral vascular problems. C. Absent in some patients due to a congenital anomaly. D. All of the above. Correct answer, D. All of the above. The dorsalis pedis pulse point is located on the arch of the foot, slightly lateral to the midline. It is frequently used to assess adequate blood flow in patients that have poor circulation. Some patients are born without this pulse point. 10. Over a patient's lifespan, the pulse rate A. Starts out fast and decreases as the patient ages. B. Starts out slower and increases as the patient ages. C. Varies from slow to fast throughout the lifespan. D. Stays consistent from birth to death. Correct answer, starts out fast and decreases as the patient ages. Normal pulse rates in infants average around 140 beats per minute. This rate falls to an average of 80 beats per minute in adults. 11. A common error when taking a pulse is A. Placing the index finger on the radial artery which is located on the thumb side of a patient's wrist. B. Noting a pulse as being weak when the pulsation disappears upon adding pressure. C. Counting the pulse for 15 seconds and multiplying the number by 4. D. None of the above will cause errors. Correct answer, C. Counting the pulse for 15 seconds and multiplying the number by 4. To accurately assess a patient's heart rate or pulse, the pulse must be counted for a full minute. Arrhythmias and intermittent pulsations may be missed if not counted for a full minute. Proper finger placement is on the radial artery which is located on the thumb side of the patient's wrist. 12. Korotkoff sounds are A. Sounds noted during diastole. B. The result of the vibration of blood against artery walls while blood pressure readings are being taken. C. Are only noted by skilled cardiologists. D. Distinct sounds which are classified into 6 phases. Correct answer, B. The result of the vibration of blood against artery walls while blood pressure readings are being taken. Korotkoff sounds are sounds generated when the blood starts to flow in an artery that has been temporarily collapsed during a blood pressure reading. There are 5 phases to the Korotkoff sounds and many different healthcare providers are trained to assess these phases. 13. The patient position that is most useful for proctologic exams is the A. Trendelenburg. B. Semi-Fowlers. C. Full Fowlers. D. Jackknife. Correct answer, D. Jackknife. The jackknife position is used on a specially designed table which allows the patient to lay face down, but keeps the buttocks elevated. 14. The best blood collection location for a newborn is A. The AC. B. The veins of the forehead. C. The heel. D. The fingertips. Correct answer, C. The heel. Collecting blood specimens from newborns is most safely done by collecting blood from the lateral or medial aspect of the baby's heel. 15. A 39-year-old woman presents for treatment of excessive vaginal bleeding after giving birth to twins 1 week ago. Which nursing diagnosis is most appropriate in this situation? A. A knowledge deficit related to postpartum blood loss. B. Self-care deficit related to postpartum neglect. C. Fluid volume deficit related to postpartum hemorrhage. D. Body image disturbance related to body changes after delivery. Correct answer, C. Fluid volume deficit related to postpartum hemorrhage. Postpartum hemorrhage may be more common among women in some situations, such as those who experienced complications during delivery or those who carried multiple gestations. Post-delivery hemorrhage puts this client at risk of fluid volume deficit related to bleeding and overall loss of blood volume. 16. A public health nurse discovers that many of the children in the neighborhood where she works are developing lead toxicity. She implements a program to screen for lead exposures among clients in the community. This is an example of social justice. B. Policy resources. C. Autonomy. D. Moral justification. Correct answer: social justice. Social justice involves working on behalf of others to find solutions to current issues and is not prohibited by class, gender, or race. Nurses perform acts of social justice when they see an issue or a wrong and work to solve it in order to provide a workable solution for those involved. Social justice determines that everyone deserves fair treatment and should have the opportunities for better care. 17. The community health nurse is educating a group of middle-aged men about recommended health screenings. Which of the following statements indicates the client has understood the recommended health screenings for a 50-year-old male? A. I should get a testicular exam every year. B. I should get a colonoscopy every 5 years. C. I should get a prostate-specific antigen test every 5 years. D. All of the above. Correct answer: A. I should get a testicular exam every year. The recommendation suggests that a 50-year-old male should get a testicular exam every year beginning at the age of 20. A prostate-specific antigen test should be started at age 50 if indicated by a physician for adult males. Colonoscopies should be completed every 10 years. Prostate digital exams should be performed yearly after 50 years old if there are no other risk factors. 18. Which situation might require an occupational health nurse consult? A. A nurse is injured from using incorrect body mechanics to lift a client. B. A nurse receives a subpoena to testify in court about a client's case. C. A client who has been injured in a diving accident needs assistance with planning rehabilitation and surgery. D. A nursing unit is implementing a new electronic health record system. Correct answer: A. A nurse is injured from using incorrect body mechanics to lift a client. Occupational health nurses assess the work environment and educate those working about safety with practice and infection control. When an injury or exposure occurs, the occupational health nurse may need to be notified in order to document the situation and help the employee access care or treatment. 19. Which of the following is the most appropriate example of anticipatory guidance for a 16-year-old who has been hospitalized for an ankle fracture? A. Changes associated with puberty. B. Driving and staying safe. C. The health hazards of smoking. D. Social media influences. Correct answer: B. Driving and staying safe. Anticipatory guidance is an educational process that provides information important to a client's situation. The nurse anticipates that the client will need the information based on his background, such as his life stage and diagnosis. A 16-year-old teen that receives care for a fractured ankle will most likely need anticipatory guidance related to overall safety and driving, as this is age-appropriate and may prevent future injuries. 20. Becky is a 17-year-old type I diabetic who has been admitted for her third episode of diabetic ketoacidosis, DKA, since being diagnosed last year. She states that she hates feeling different than her friends and refuses to take her insulin as recommended. What would be the most helpful action for Becky? A. Scold her for not taking her insulin. B. Recommend that she use an insulin pump. C. Contact the local support group for diabetic teens. D. Tell her parents they must provide more strict oversight. Correct answer: C. Contact the local support group for diabetic teens. Contacting the local support group for diabetic teens to see if another diabetic teenager would be available to provide support for Becky would be the most helpful action. Such collaboration would provide her with the ability to identify with someone in her peer group who faces the same issues she does, decreasing her feeling of isolation and being different. 21. Which of the following is a true statement about assessing blood pressure by palpation? A. Only the diastolic blood pressure can be assessed through palpation. B. The palpation technique is most useful for infants and small children. C. Hypertension is a common condition that might need to be assessed through blood pressure palpation. D. Only the systolic blood pressure can be assessed through palpation. Correct answer: D. Only the systolic blood pressure can be assessed through palpation. Palpating a blood pressure may be necessary in some clients with pressures that are too low to be heard through a traditional stethoscope. Clients who have fluid volume deficits or decreased cardiac outputs may need blood pressure assessed through palpation. When performing this maneuver, only the systolic blood pressure can be assessed. 22. A student health nurse working at a college is discussing lifestyle choices with a female client who came to the office today. The female client is sexually active and informs the nurse, "I use condoms every time, as far as I know." The student reveals that she is not sexually active exclusively with one person. Which of the following topics should the nurse include in her teaching when educating the client? A. Information on STI testing. B. Substance use disorders. C. Contraception. D. All of the above. E. Both A and C only. Correct answer: D. All of the above. Based on the information the client provides to the nurse, it is important that the nurse take the opportunity to discuss the client's lifestyle choices. The nurse in this situation would want to discuss contraception to prevent an unwanted pregnancy and STI testing. The client states she uses condoms as far as she knows. This is a red flag to the nurse that substance use may play a role in the situation. Therefore, information on substance abuse should be included. 23. A nurse is assisting a pregnant client who is having an amniocentesis. Which of the following statements by the nurse indicates the correct teaching for this procedure? A. I'm going to help you lie flat on your back for this. B. Don't worry, I'm sure everything will be alright. C. I will need to help you remove your shirt for this procedure. D. Now that the procedure is finished, I will put a small bandage over the puncture site. Correct answer: D. Now that the procedure is finished, I will put a small bandage over the puncture site. An amniocentesis is performed to draw amniotic fluid from the sac around the fetus during pregnancy. It may be analyzed for certain disorders or complications associated with pregnancy. Following the procedure, the nurse should wash the client's abdomen and place a small bandage over the puncture site. 24. A nurse is caring for a client who is in labor. The nurse has attached an electronic fetal monitor to the client's abdomen and is assessing the baby's heart rate. She notes that the baby's heart rate seems to slow down during each contraction. The heart rate does not return to normal limits until after the contraction is complete. Which type of fetal heart rate change does this pattern describe? A. Variable decelerations. B. Late decelerations. C. Early decelerations. D. Accelerations. Correct answer: B. Late decelerations. Late decelerations occur when a baby's heart rate declines in utero during each contraction. The heart rate drops below baseline and remains there until after the contraction is complete. Late decelerations are a non-reassuring sign and should be reported to a physician. 25. Which of the following reasons indicates a need for a non-stress test in a pregnant client? A. The client is overdue. B. The baby has not been moving. C. The mother is carrying twins. D. All of the above. E. Both A and C only. Correct answer: D. All of the above. A non-stress test is performed to assess the baby's heart rate and activity during pregnancy without adding any stress to the fetus. A non-stress test may be performed on a woman who has not felt movement from her baby recently, a woman who is overdue, or a woman who is considered to have a higher risk pregnancy, such as someone carrying twins. 26. The key to the prevention of a pandemic influenza is A. Early detection. B. Early antibiotic treatment. C. Vaccination of at-risk populations. D. Isolation of suspected cases. Correct answer: early detection. Early detection of influenza is the key to prevention of a pandemic. The most important warning signal is when clusters of patients with clinical symptoms of influenza are detected. 27. Which risk factor places patients and residents at the greatest risk for falls? A. Old age. B. Middle years. C. Pneumonia. D. COPD. Correct answer: A. Old age. The elderly are at great risk for falls. Those in middle years are less at risk than the elderly population. COPD and pneumonia are not risk factors associated with falls. 28. A nurse is working at the community clinic and is completing a risk behavior assessment on a 16-year-old sexually active female who is coming to the clinic for birth control. The nurse should recommend the client undergoes which of the following? A. Pregnancy test. B. HIV testing. C. Pap smear. D. All of the above. Correct answer: D. All of the above. The nurse should suggest the female client undergoes a pregnancy test prior to beginning birth control. Also, the nurse should suggest the client undergoes a Pap smear, HIV testing, and other sexually transmitted infections, STIs, STI testing if she is sexually active. The nurse should also take the time to educate the client on safe sex and prevention of STIs. 29. You are taking care of Mary Eden. She is an elderly and frail 91-year-old resident. She gets confused during evening hours and at times she thinks that she hears her daughter calling her from the other side of the nursing home. Which physical problem places Mary Eden at risk for falls? A. Her confusion. B. Her daughter. C. Evening hours. D. Her frailness. Correct answer: D. Her frailness. Mary Eden has frail and weak muscles. This places her at risk for falls. Her confusion places her at risk as well. However, this is an emotional or thinking problem, not a physical problem. 30. What kind of preventive measures is most likely to be used to prevent Mary Eden from falling because of her muscular frailness? A. Physical therapy for muscle strengthening exercises. B. Physical therapy for range of motion exercises. C. Occupational therapy to help her with confusion. D. Medications in order to have her sleep more. Correct answer: physical therapy for muscle strengthening exercises. Mary Eden will most likely benefit from physical therapy muscle strengthening exercises because of her muscular frailness. Range of motion may also be used, but muscle strengthening exercises will be the most beneficial. Occupational therapists do not treat confusion, and sleeping medications add to falls risk, they do not prevent falls. 31. Elderly patients are more prone to dehydration than younger people because the elderly underscore A. Drink more coffee and tea. B. Have more stomach mucus production. C. Have more saliva. D. Have less sense of thirst. Correct answer: D. Have less sense of thirst. Elderly patients are prone to dehydration because the elderly have a lower and diminished sense of thirst. They do not get thirsty in the same way as younger people do. The elderly also have less stomach mucus production and less saliva, but these changes do not impact on thirst or dehydration. 32. Select the age group that is coupled with an infectious disease that is most common in this age group. A. Infants, high bilirubin. B. Preschool and school-age children, shingles. C. Young adults and teenagers, sexually transmitted diseases. D. The elderly, malaria. Correct answer: C. Young adults and teenagers, sexually transmitted diseases. Young adults and teenagers are at greatest risk for sexually transmitted diseases. High bilirubin is a laboratory finding and not an infectious disease. Preschool and school-age children are not at great risk for shingles, the elderly are. Lastly, old age is not associated with malaria. It is associated with shingles. 33. A nurse is providing information for a woman who is 36 weeks pregnant and who has hepatitis B. Which of the following statements from the client indicates understanding of this condition? A. Now I know I will need a cesarean section. B. My baby will need 2 shots soon after his birth. C. I will not be able to breastfeed. D. My baby's father does not need testing. I know I am the one with hepatitis. Correct answer, B. My baby will need 2 shots soon after his birth. A baby born to a mother with hepatitis B should ideally receive 2 injections following birth to diminish his chances of contracting the disease. Within the first 12 hours following birth, a baby born to a hepatitis B positive mother should receive the first in the series of hepatitis B vaccines. The baby should also receive an injection of hepatitis B immune globulin, HBIG, to provide further protection against the virus. 34. A nurse is caring for a 2-day-old infant who has a bilirubin level of 19 mg per dl. The physician has ordered phototherapy. Which of the following actions indicates correct preparation of the infant for this procedure? A. Undress the baby down to a diaper and hat. B. Place the baby in his mother's arms before turning on the light. C. Position the phototherapy light approximately 3 inches above the baby's skin. D. Secure eye protection for the infant without occluding the nose. Correct answer, D. Secure eye protection for the infant without occluding the nose. Phototherapy is used to treat high levels of bilirubin among infants, typically evidenced as jaundice. The nurse must position the infant carefully during this procedure in order to maximize the benefits of the light therapy while protecting the baby at the same time. The nurse should place protective eyewear over the baby's eyes without occluding the nose, in order to protect the eyes from the ultraviolet light. 35. Mrs. D is a pregnant client who is 33 weeks gestation and is admitted for bright red vaginal bleeding. Her physician suspects placenta previa. All of the following nursing interventions are appropriate for this client except A. Institute complete bed rest for the client. B. Assess uterine tone to determine condition. C. Perform a vaginal exam to assess cervical dilation. D. Measure and record blood loss each shift. Correct answer, C. Perform a vaginal exam to assess cervical dilation. A client with placenta previa has part of the placenta covering some or all of the cervical opening. A vaginal exam for placenta previa may cause significant bleeding and should be avoided unless directed by a physician and preparations are made for emergency delivery. 36. A nurse is caring for Mrs. L, a pregnant client who is 35 weeks gestation. The client complains of abdominal pain, her abdomen is rigid and she has little vaginal bleeding. The nurse notes few fetal accelerations on the fetal monitor. Which of the following conditions most likely describes these symptoms? A. Placenta previa. B. Prolapsed cord. C. Preeclampsia. D. Abruptio placentae. Correct answer, D. Abruptio placentae. Abruptio placentae occur when the placenta separates from the wall of the uterus before the baby is delivered. A clot may form between the placenta and the uterine wall, causing internal bleeding that may not be outwardly apparent. Signs and symptoms of abruptio placentae include a rigid, board-like abdomen, increased fundal height, little vaginal bleeding or discharge, and late decelerations on the fetal monitor. 37. Mrs. L's blood pressure has dropped to 86/58 and her heart rate is 112 bpm. Based on her assessment, what is the most appropriate action of the nurse? A. Insert 2 large bore IVs. B. Elevate the head of the bed. C. Insert an indwelling catheter. D. Both A and C. Correct answer, D. Both A and C. Depending on the amount of bleeding, abruptio placentae can be life-threatening to both the mother and the fetus because of fluid loss. The nurse should insert 2 large-bore IVs in order to administer fluids and blood products if ordered. Mrs. L is showing symptoms of hypovolemia based on her vital sign changes. Because she is 35 weeks gestation, the nurse should insert an indwelling catheter for prompt cesarean delivery. 38. A nurse is performing an education session to a group of middle-aged adults on prevention of osteoporosis. Which of the following statements made by the client indicates they need further teaching regarding prevention of osteoporosis? A. I should discuss taking calcium and vitamin D supplements with my doctor. B. I should participate in 30 minutes of swimming most days of the week. C. I should participate in 30 minutes of walking most days of the week. D. I should discuss a bone density scan, DXA, with my physician. Correct answer, B. I should participate in 30 minutes of swimming most days of the week. Swimming is a non-weight-bearing activity, therefore it does not contribute to bone density. Walking or running are good examples of weight-bearing exercises that decrease the risk of bone loss. Calcium and vitamin D supplements may help slow bone loss. 39. A patient presents with vesicles covering the upper torso. Which of the following situations could cause this condition? A. Knife fight. B. Auto accident. C. Sunburn. D. Fungal infection. Correct answer, C. Sunburn. Vesicles is the medical term for blisters. A second-degree sunburn could blister, forming vesicles over the affected area. 40. Mr. and Mrs. K have just adopted a newborn infant and are preparing to take him home from the hospital for the first time. Which safety measure is most appropriate for the clients in this situation? A. Turn the handles of pans on the stove inward. B. Set up a baby gate at the top of the stairs. C. Cover electrical outlets with child-proof plugs. D. Install an approved car seat that is facing backward in the back seat. Correct answer, D. Install an approved car seat that is facing backward in the back seat. Parents of newborn infants should use an approved car seat that has been installed facing backward in the back seat of the car. Securing infants in car seats, even from the first ride home from the hospital, promotes safety while transporting. While safety measures at home such as baby gates or outlet covers are important, they are not priority safety measures until the baby is old enough to be mobile. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channels for more resources.